Namaste. I am Dr. Rohini, consultant gynecologist in Apollo Specialty Hospitals, Nellore, as a full-time consultation here. Today I would like to give a brief interview about overview discussion about high-risk pregnancy clinic and infertility clinic and basic cancer screening program. In high-risk pregnancy clinic, people like any medical complications like blood pressure, high sugar values, and past history of heart disease, past history of bronchial asthma, past history of infections, and past surgical complications like previous history of ovarian cyst removal, previous uterine surgeries, previous fibroid removal surgeries, and any present obstetric complications like elderly primi gravida, the age is more than 35 years, and previous history of stillbirth, no live child, previous history of multiple abortions, previous history of recurrent pregnancy losses at the age around the 7th month, 6th month pregnancy, and present obstetric complications like growth restricted babies, excessive liquor, scanty liquor, decreased fetal movements, and present scenarios. And every time when the patient came to my department in OPD, first I would like to write brief introduction about her history and vital monitoring, clinical examination. Next, according to the case scenario, basic investigations are done. After that, we will discuss with the diet management, activity management. Some people prefer physical activity, some people where the pregnancy the placenta position is low lying position and previous history of multiple surgeries on the uterus. Usually we educate the patient about the limited physical activity, and ultrasound monitoring every 2 to 3 weeks according to her present scenario, and the treatment is given. In this hospital we have every minute aspects, intrapartum fetal monitorings are there, NST is there, best nursing care is there. So we would like to give basic treatment, and if necessary we would follow the case after the delivery also, depending on the some medical conditions. So next clinic is infertility clinic. So any marriage after 2 years of unprotected sexual intercourse, patient doesn't conceive in spite of regular sexual intercourse. Usually the patient came to my gynec department after proper history, basic hormonal profile is there, and ultrasound, pelvic ultrasound is there, and there is a particular tubal test on the 7th day of her cycle. We are doing regular tubal test, and from 11th day of the cycle we are monitoring the egg size, whether the egg is properly developed or not. Usually we will monitor every day the egg development is about 1 to 2 mm. So around 18th day the egg development normally is around 18 mm to 20 mm. If the egg development is not proper, according to the dates we are giving injections and medicines. After the egg development, 5 to 10% of the cases the egg is naturally not ruptured. So in such cases we are giving injections for the egg rupture also. We are giving the medicines for natural conception. After 3 to 4 cycles of natural conception, the woman not getting pregnant, we are giving advanced treatments like intrauterine insemination with husband semen at the time of egg rupture, and after 2 weeks of insemination we are giving medications for 15 days and wait for the period next getting periods or urine pregnancy test positive. After that the follow-up is like that. So next clinic is cancer screening clinic. Cancers here in that cancer screening clinic we are done regularly pap smear and mammogram and basic ultrasound pelvis. So pap smear is after 3 years of marital life, every woman every 3 years of her age. We are doing regularly. We are educating the patient about the pap smear. If the pap smear screening, it is a screening test only. If it is 50% positive and 50% negative, if anything abnormal in the pap smear, next step we are doing with colposcopic guided cervical biopsy for 100% confirmation. After cervical biopsy report, educate the patient about the nature of the condition, management and treatment options. And for benign tumors of the cervix, here we are doing cryosurgery and laser surgeries. For malignant diseases, stage 1, we are doing hysterectomies. Next screening test is mammogram. If in any woman with family history of breast cancer or uterine cancer, the screening test should be started around the age of 35 years. If there is no family history of breast cancer, uterine cancer, the screening test should be started from her age of 40 years every yearly. The mammogram report, after seeing the mammogram report, the follow-up date should be scheduled. Next is ovarian cancer screening. So from 35 years of age onwards, every year we are educating the patient about the basic ultrasound pelvis, and if there is any ovarian cysts or ovarian tumors, we are writing blood test to confirm the diagnosis. And here there is a cervical cancer vaccines are also available. In younger age group the vaccine is separate, and in the middle age group the vaccine is separate. So usually 3 doses schedule is there, 0, 1, 6 months schedule is there. Here we are giving routinely this, we are educating and we are giving the vaccine schedule also.